He is one of the most outstanding chiropractors that we have in this country, is always winning at awards. When you walk into his room, everyone's using the AVACEN. Everyone's hooked up to all these incredible things that are all Nobel Prize winning. And hopefully one day the AVACEN will be as well, which would be really cool. And he is just a spectacular human being and practitioner, healer, and just an all-around awesome person, Dr. Codrin Blosiu. So it's all your turn now. Thank you for being here, Codrin.
Thank you, Danielle. Thank you, Tom, for having me. I'm not to talk too much about myself. I'm going to just do a little bit of intro of how I use the AVACEN as a life-changing discipline that you can incorporate into your lifestyle elegantly and effortlessly. My background is I started in neuroscience. I was a professor of neuroscience at UCSD. Got into chiropractic, had some injuries. Had the pleasure now and privilege and honor to be a consultant with our Navy SEALs, a little bit with the International Space Station, a little bit with the International Olympic Committee. So I've had the pleasure of seeing a lot of beautiful people. I do sit on the stool as a giant, so I look tall because I'm standing on her shoulders. But it is a life-changing process that is so elegant and simple. Originally, I used it with my Navy SEALs to treat a bit of hypothermia. Our boys get cold. We noticed that for PTSD, it was really exceptional and reduced anxiety. They were able to sleep better. And we know that arrested the amount of recovery, decreased recovery time. You only perform as hard as you recover. And this was able to be a game changer for our boys. So it was really a pleasure to see that happening. With that came a decrease in anxiety. And that meant now they're able to act on and off the field in elegant ways and in decisive ways that we're able to have the best of all of our interests of our international security. So it's really a beautiful thing. It doesn't just increase in circulation. It doesn't just decrease toxins. It doesn't just increase pH. All these things come together to create an environment for the body that is healthier, cleaner, younger, more active, more resilient, more able to respond. And that is really what is the name of the game, whether you're in the special forces, whether you play tennis, whether you are a runner, or even if you're at home, as we all do now, sheltering in place, and healing our minds, our bodies, our spirits. I want to talk a little bit about pain. And pain is something that we talk about AVACEN being helpful for, but pain is such an esoteric statement. Pain could be physical, mental, psychological. It could be active, like you're actually in pain. It could be reactive. It could be something that you are thinking that may happen in the past. You may be thinking of past that may happen in the future. You can be thinking about something that happened in the past. These things can be crippling for not just our armed forces, not just our athletes, our astronauts, but for everyday human being. Being able to take this huge obstacle out of people's lives, even temporarily, although we've seen much more lasting results than temporary, is a real gift. The investment is nominal when you look at the rewards, and if you count out how many Advils, bottles of Advil you buy, or bottles of aspirin, or Tylenol, and you'll be amazed at over a lifetime, over even 2 years, how the price points are so powerful. So the real magic of the AVACEN is not just how it reduces pain, not just how it increases your lifestyle, but actually saves you money, and that's kind of a big deal, especially when we're looking at able to increase our productivity. The fact that it's touchless in this day and age is wonderful. I use it coherently and with other devices, as Danielle was elegant pointing out, with lasers and magnetic field therapies, neural feedback. I use it in health and wellness and beauty. And all these things are made more potentiated, more healthy, more elegant, and easier to do, to the point where my patients, before I even set them down, ask for the device by name. They know it. They want it. I have the devices in there. they don't really care so much about the lasers. They don't really know what the pulse magnetic field therapy does. What they feel is the warmth and comfort of these of this therapy. The point that my room actually has been nicknamed the Snoratorium, where people come in, they're anxious, they can't sit still, they have ADD, and yet in 5 minutes they are snoring happily on my table. And that's a testament to the faith they have in the device and the actual productivity and production of good things, including endorphins. So all these things are very, very powerful for me and very powerful for us. In a lovely seminar, I didn't make this up. I learned that if we take the I and we replace it with we, even illness can become wellness. So in this regard, we take the I, we become the we. We are now the distributors. We are now the banner carriers for the new generations of health and wellness and specialist therapy. So it's really an honor, a privilege, and a humbling for me to be in such incredible company with such beautiful people, sharing the small things that we do. So
I think the most amazing thing is all the different types of people that you see on a day-to-day basis, and every single one of them always starts with the AVACEN. Can you talk about that a little bit?
Absolutely. So whether they're little children who come to me for bruises and headaches, and some have migraines, or college students, graduate students, and then moving up through all the level of maturity that I get to see, it's unbelievable how this little thing, this little, what I call just a warm box, is so much more than it's actually really a magical box, and we have the magic right there. The genie's still in the box, still in the lantern. So we have that ability to tap that. It's really lovely.
Okay, of course, you mentioned the International Space Station, so everybody wants to know a little bit about that, if you don't mind.
Okay, so there's a lot of preparation for our ladies and gentlemen that go up, pre-flight and post-flight. Post-flight in particular, due to obviously the lack of gravity, that's a big deal, but also the effects that we have of a solar and extrasolar radiation affecting our genetics. And that makes our bodies actually more toxic, more acidic. The AVACEN is beautiful and the call for not only reducing the inflammation, the edema that they experience from the lack of gravity, but more importantly, of helping detoxify their body, create that environment again that is more alkaline and less acidic that we see from this exposure to solar, extrasolar radiation. It also increases circulation to their peripheral capillaries, which are so diminished by lack of gravity, because gravity really does pull things down, pushes things around. So it's been absolutely wonderful in pre and most importantly post-flight.
Terrific. So we have Dr. Julia Mason with us today, and she wants to know, do you use the activator device? Do you see a difference after using AVACEN before your chiro treatments?
I always use it before my chiropractic treatments.
Yes. Can you explain why you do that, please?
Oh, absolutely. So the chiropractic, the actual physical adjustment for me is a contract I enter with my patients. I'm giving them exercise to joints and different parts of the body that are sometimes unable to do themselves. So the AVACEN is my go-to for increasing circulation, which, as Joe was saying, how elegant it is to help prepare the body for reducing lymphatic congestion from massage. This increases circulation even to the joint capsules, allows my adjustment to be with much less force. In fact, I use very little force and much painless, with much pain if not done. More importantly, my patients don't have some of that side effects that some patients have after chiropractic adjustments, which is delayed pain response, because now their joints, their body wasn't ready for it. So it's been really elegant for allowing me to get the actual chiropractic part of my endeavor to move so more elegantly, so much more smoothly.
Perfect. Yeah, you've always told me that it just, by the time you get to them to do your minor adjustment, and before I found you, I was going to some chiropractors, and one time somebody adjusted my neck and I saw stars, and I was like, okay, that's it for me. And I have a little PTSD about that. As you know, I'm like, don't touch my neck. And you're like, I know. So, everybody has their own techniques, but your technique is so gentle, and the AVACEN helps you with that. But not only that, you see how many people a day?
I used to see more pre-COVID, of course, now due to
Right.
the situation. I'm not your typical rack and crack 'em, thank you, wham bam kind of guy. I only see about 10 patients a day.
Right.
I see an hour a day, an hour personally with the patient, no assistance, nothing else, just me and them. And so AVACEN is an integral part of it because it allows me to have that connection with them and have that 20 minutes, half an hour where they get to slow down, and I get that lovely, lovely, lovely connection with them. So yes, only 10 patients a day. But
still, that's a lot on your body personally. So the AVACEN helps you deflect a little bit of that too. So.
Absolutely. And it helps me heal from force in, force out. And so I would not be able to recover as elegantly as if I didn't have the AVACEN to use myself personally on me.
Right. So, Codrin, if people are talking to their chiropractors when they talk about AVACEN, what are the three things that you could discuss with another chiropractor about the AVACEN? What would you suggest?
Okay. First of all, price point. The price point of a AVACEN unit compared to billing, because I do bill it as dry heat therapy or fluoridized heat therapy, so it is a very easily compensatable and billable attribute. Two, it slows things down. Sometimes in this fast-paced world, by slowing things down, by giving you a chance to really connect with the patient having some downtime, it makes the whole experience so much more personal, so much more beneficial for everybody else. And thirdly, it's patient satisfaction. In the end, we're in the business, all of us, as human beings, should be in the business, in the ritual of helping other people and fulfilling our destinies in that elegant way. The AVACEN allows you to have patient satisfaction. People walk out happy. They feel like they're listened to, they're helped, they're also healed, and they attribute it to the AVACEN more than to me most of the time, which I absolutely love. I think it's fantastic. Really.
Thank you. So, have you ever worked on anybody that has tinnitus?
Tinnitus is a very interesting situation. Can come from many directions. It can be caused chemically. It can be caused functionally from impact inside the ear inside the cochlea. It can be neuropathic. It can also be just degradation of cell tissue, lack of nutrition. The AVACEN is exceptional in increasing that circulation, that bringing the nutrients to the tissue. In correlation with some work with lasers, it has been beneficial in a lot of my patients. Now, everybody's different, and everyone presents in different ways. Some things take time. If you've had a situation that you've had for, let's say, 10 years, well, it'll probably take me a little bit more time to get there. We have to kind of make the app exceptional with tinnitus, and a lot of the aspects that have to do with not only the nutritional part of it, but also the neural aspect of tinnitus. So it's been exceptional for that as well. The best I've seen it. I'll leave with just one story. This is a case study, so this is not something that you can expect to see in every patient all the time. But I had a patient who is 42 years old, and he came to me. He's a lawyer, and he came to me with the beginning stages of Parkinson's, and he'd been suffering for about a year and a half. And to the point now, he was uncomfortable. He was a litigator. He was uncomfortable going in front of the judges because when his hands would shake, he just felt like that wasn't something that he was comfortable sharing with the judges. So he came to me after 3 treatments. I got a little worried because I didn't see him for a month, and I didn't see him for 2 months, and I didn't see him for 6 months. And so finally, I kept, had the front desk call him and say, is he okay? Did we lose him as a patient? Did I do something wrong? And the response was an emphatic no. He's doing great. His Parkinson's has had regressed. He is litigating again in front of the judges and winning cases, as always. But happier than can be with just a few treatments, with literally about 2 months worth of treatments. So again, this is not something you would expect to see in every time, every person, but with something like Parkinson's that is so devastating, and also something you see socially because it affects you when you're doing it intentionally, moving your hands, the intentional tremors, it was outstanding, absolutely outstanding.
Yes, I remember you telling me about that one. And the other one that I remember you telling me about was, and I actually got to meet this young man. He was a ranger, and remember this one? Yes, and he used our device in your practice, and he told me personally that he couldn't get off the couch or out of bed in the morning unless he used our device. And to me, that is why we get up in the morning and we do what we do for people like that, especially for our veterans.
Absolutely. Our veterans they pay the greatest price. The gentleman was not just an Army Ranger, but he was also a Navy SEAL. He was a Navy SEAL Master Chief. And at 52 years old, you look at him and you do not see a more fit specimen of a human being, and yet he was in such tremendous pain. He couldn't get out of his car. He couldn't get out of bed. He couldn't feed his dog. And within weeks of therapy, and it was unbelievable to see him again and be able to go surf with him and be able to see him being active again. And it just breaks my heart when I see our armed forces not have that kind of support.
One more question for you, Codrin. Thank you, and then I'll let you two go because I know you have things to do today. And I just want to thank you for your time and for blessing us with, and this whole group with your decades, both of you, of your knowledge and sharing. So I believe how much time do you use for your patients with the AVACEN? Do you do 20-minute treatment, 30? And I know it depends on the person.
Correct. It depends. I try to get at least 20 to 30, depending on how much my intake takes. The other parts of my therapy, I usually do multiple stages for my therapy, but I really find that even 15 minutes is very beneficial. But if I get it to 30, now that seems to supercharge the treatment. Those are the ones that really seem to do the best. If I have the time and have the luxury sometimes to have the time to have the patient use that device for 30 minutes, that really seems to be a bit of a magic number with my patients. I
agree. And they're there anyway. You've got them all hooked up on your table. You may as well give them a 30-minute blast, right?
It as well. Absolutely. I get after my name. If I don't do it, you remind me.
I love that.
What about the AVACEN? Hey, Doc, wait. I had my hand. It hasn't turned on yet. Oh, hey, Doc, it's not ready. They let me know. They keep me on the ball.
Right. I remember you telling me the story when you first took our little blue box to the Navy SEALs, and they're like, what the hell is that? Right. And then all of a sudden they're like, where's the blue box? Yeah. And then the next thing was, where's my AVACEN? So, and they're tough.
No, some of the boys wanted arm wrestle for it. No, I want to go first. So I want to go. No,
that's awesome. Well, okay, you two keep doing you because you both of you brilliantly. And safe travels, and I hope to see you all soon. Thank you for your time. We can't wait to hear more because everyone's going to bother me until you come back again. I can already see the emails coming. So, and one day when we can all get together in person, I can't wait for everyone to meet you in person because I love you as much as I do. So thank you very much, and drive carefully.